Topic for this afternoon is all about nematodes. So nematodes, as a general features, they have elongated, cylindrical, smooth, and segmented flesh-colored bodies. So the body is usually tapered to a pointed posterior end and rounded anterior end. So the body is covered by a non-cellular, highly resistant coating, the cuticle. So they have the complete digestive system with mouth, esophagus, midgut, and the anus. So all are non-hermaphroditic. So they have separate sexes. The female is usually larger than the male. So, for the infection to occur, it's either by eating uncooked meat with the larva inside or with the infected larva, by, of course, direct entrance through the skin or cut or punctured skin, or by transfer by your sucking insects. Okay, they are also can cause infection by just, of course, in para, by simple ingestion of the infected egg or the infected larvae. So they are classified into two main categories according to their primary location. So you have your intestinal nematodes and you have your tissue nematodes. So they are under subclass Spiruria and then subdivided to the subfamily and everything else. So I just put that, but that's not important in medical parent. So what are the differences between your intestinal and your tissue nematodes? Sige, screenshot yun. Napaisa, nasa sakyanan, nagklase. So if ever na ako sa school, akog chance na absent. I really make time and effort for this, and then I can see you're listening in your car. Okay, very good. So when you say of intestinal nematodes, they are usually large in size, cylindrical. Most adult worms live in your intestinal tract. So most of their diseases are diagnosed by identifying their characteristic eggs in stool. So, compared to your tissue, usually your tissue nematodes are elongated, cylindrical. They inhabit either your lymph nodes or your lymph vessels, your skin, and your subcutaneous tissues. So the diseases are diagnosed by demonstrating the microfilariae in the blood or in the tissue or the tissue fluids. So what are your medically important nematodes? So for the intestinal nematodes, you have the most commonly encountered parasite in our country. You have your Enterobius, you have your Ascaris, you have your hookworms, and your Trichuris trichiura and Trichinella spiralis, and your Strongyloides. Okay. And for the tissue nematodes, you have your, if you're familiar with, you have your filarial worms that causes your filariasis or filaria infection. So usually they are lymphatic parasites. So under that are your Wuchereria bancrofti, your Brugia malayi, and for the cutaneous, you have your Dracunculus medinensis, your Loa Loa, and your Onchocerca volvulus. So for the general cycle, so as what I've told you before in parasitology, it's some like or somewhat the same. So ingestion of the infected larva or egg, and then after ingestion, there's the cycle inside your intestine, and then they are reproduced in your intestines, then will join with your stool, then back to the nature again, then back to ingestion again to be infected again. So that's the general rule or the general life cycle for the nematodes. So actually nematodes are very common in the Philippines. Nematode infection. If you I know some of you or most of you hear about the nematode infection, George. So I think no one or nobody cannot relate to your nematode infection. So for the tissue nematodes, there is another life cycle compared to the tissue. So in your tissue nematodes, I mean to your compared to your intestinal nematodes. So for your tissue nematodes, you need to have an intermediate host. So example of that is your the commonly animal that we usually eat. So of course the pig, sometimes the cattle, sometimes the other animals, the bear, the boar, the in other countries. And you need to have a intermediate host to be infected. Usually, the human will be infected by ingestion of your undercooked meat. Okay? So, always remember that. So, tissue nematodes, undercooked meat. So, because the larvae are usually found on your striated muscles or in the muscles. So if not properly cooked, of course, the parasite will stay there and will be digested to your stomach until to the intestine. So also for the mode of transmission compared to your intestinal nematodes, for your intestinal nematodes is ingestion, right? So for the tissue, you need to have it is usually transmitted still with ingestion, but some through tissue nematodes. Some by tick bites and all. Mali ata ni na slide. This is for the intestinal. So the common pattern is the worm develops in the intestine, the eggs are released with the feces, then into the environment. So in the environment, the mature eggs are ingested by the host and hatch in the small intestine and the intestine again, giving up the larvae. Then the larvae will become adult, then will produce more eggs again that will be developed in the intestine, then will be released in the feces again, then back and forth. Okay, so that's the reason why, if you remember during your childhood, you are not allowed to go outside without your slippers and shoes because of this mode of transmission of the parasite. If you remember, you're not allowed to step foot on the soil without your sleepers. Okay, so this is the reason why. Okay, maybe you will get the parasite. So these are the examples of the most or clinically encountered nematodes, intestinal nematodes. You have your Enterobius, your Trichuris, your Ascaris, your hookworms, Strongyloides, Trichinella, and Anisakis. Okay. So, for the vector, remember, in intestinal nematodes, no vector needed. For the stages that infects the human, it's there. So, I hope you will study this table. Very simple table, but very informative. So, easy to memorize and easy to remember. So, when you say of Enterobius and Trichuris and Ascaris, the stage that infects human is the eggs or are the eggs. So, when you say of the hookworms and the others, always remember of the filariform larvae that enters your skin. So for the stages in human most associated with disease, so usually for Enterobius, the female worm migrates out anus and lay eggs. If you don't want to listen to the lecture, you can always go out and leave the room. Kaysa I will see you there laughing and just making chika. Last warning. If you are not interested to listen, it's okay with me. You can leave the room. So are you ready now to listen? This is the reason why I don't like online, because you will not listen. Just laughing there, making chika-chika, disrespecting your professor. This is a big deal. Why? Because I got distracted. I got distracted. You study that slide, you study that table. So let's go to your interrobius and your ascaris. So, interrobius, also known as your pinworm, your seatworm, your oxyoris worm, or enterobiasis, or your oxyuriasis. So, this is a very common parasite, especially in the toddlers. But you can also see this in the adult human, especially those living in the very remote areas. So, especially, example, mga badyaw. So, the infective stage is your embryonated egg. Then the transmission or the mode of transmission is ingestion, of course. Then you will have also your auto-infection via your nails or by scratching your perianus. So the habitat are your large intestine, and the ova characteristics are eggs in the nails or perianus or the perianal area. Then eggs are colorless and asymmetric with one flattened side as described. Okay, compared to your ascaris, your ascariasis, or also known as your ascariasis or your roundworm ascariasis, your roundworm infection, um, this is also most one of the most common in parasite infection, or the parasitic one of the most common parasitic infection that you encounter, or even you experience it during childhood. Okay. So the infective stage is the same, embryonated egg, and the transmission is ingestion of eggs found on your food, not well prepared food, and water or contaminated with human feces. So that's why we always wash our hands and everything else. This is the reason why, to not get the ascaris infection, especially in the slum areas. So the habitat are your small intestine, and lungs. So why lungs? Because ascaris are also called your larva migrants. It can travel. It can travel to different parts of your body because they are migratory parasites. So through your circulation, it can travel and it can stay there for how many years and or months. So for the ova characteristic, the egg in the feces, then the eggs are described as oval in shape, brown, with colorless shell containing with very large fertilized unsegmented ovum. So for the signs and symptoms, for your enterobius, you'll have your perianal pruritus, especially at night, or done, then you have your appendicitis like symptoms, abdominal pain, the right lower quadrant pain, and everything. Hypogastric pain, and or abdominal colic like pain. So the reason for that is that there is invasion of your parasite in the large intestine. So munang so, usually we describe the child with these signs and symptoms na irritable, sa tawag in layman's term, di siya mahimutang. So the child cannot describe, it's really painful. So the description of the abdominal pain is very vague. So the child cannot pinpoint if it's really painful or not, but the child is some like parang irritable and confused where some of your interrubios can also cause your genital tract infections like vaginitis and pelvic or peritoneal granulomas. For the diagnosis, very simple. Direct microscopy using your Scotch tape technique or your adhesive tape to get the eggs or the adult worms. So usually we do this during dawn time. So if you remember, I don't know about you. If you remember during your toddler years, your mom, I don't know if your mom had a story na she will get a spoon or with Scotch tape, then put it in your anus during early morning or at dawn. I don't know if you can remember or if your mom told you a story with it. Okay, that's the reason why. That's the reason why, because they want to know if you have interrubius or parasitic infection, especially if they notice that the toddlers are always scratching their anus. So the instinct of the mom will do the Scotch tape technique. Okay, so that's very common. So you too, excuse me, you too, if you become a mom, I think you will do that also, especially if you will see or you will notice that your child is always scratching her anus. Okay. So compared to your ascaris, the signs and symptoms are different. So sa ascaris, sometimes they are asymptomatic lang, but sometimes always the common um complaint, abdominal pain, bloated abdomen, like that. So they're also, as what I've told you, they are migrating worms that can cause occlusion in the biliary tract because they like the lungs and they can travel through through the lymphatics to your circulation and everything else. So that's why if there are in the lungs, some will complain with dyspnea. So difficulty breathing. So there's a case with that, came into the ER. We have no really focus and we thought it's pneumonia or asthma. There's none found in the x-ray, only to found out na at during the stay in the ER, when the patient coughed, the patient coughed adult ascaris. So that's our point na, oh, this is ascaris di. So we just treat the patient with the drug of choice. Then the patient is okay. So unless if it really caused like example, occlusion in your biliary system. So sometimes the patient with that infection will have very painful abdomen. So sometimes mimicking a cholecystitis na, and there's infection already, high fever, and all. So sometimes na dili siya ma-diagnose with your normal labs, but it can be diagnosed or seen on your regular ultrasound. Sometimes also in children, we have the bullae of ascaris on your in the intestine. So um during my clerkship, I assisted in the OR. We think na there's a case of intestinal intussusception, but when we opened the abdomen, it showed that there's many worms. So it formed a ball in your intestine. So b- during the ultrasound, they cannot specify if it's worm or just a mass or intussusception lang. But when we open, there's so many ascaris found in the intestine, and the surgeon removed that and some of the parts of the intestine. Okay, so that's the heavy ascariasis infection na. Severe ascariasis infection. And that child was a son of a Badjao. Okay. So that's why I exampled the Badjao. Because as you notice, the Badjao, they are not wearing proper footwear. They are not practicing the proper hygiene and the proper disposal of their waste also. They are not practicing that. Okay. So that's why they are the most common example of this nematode infection. Okay. So for the ascaris, you can do direct microscopic smear. So ascaris can be diagnosed by a simple stool exam. So the characteristic egg, you have the very big, good na oval shaped egg that can be seen in the microscope. Okay? So, and very common ascaris na you can see the larva or the adult worm that will go out in the anus or any parts of the body. Okay, will some in the mouth, some in the nose, some in the ears. Okay, that's possible because of they are migrants. They are larva migrants through your circulation and lymphatics. They can travel around the body. Okay, for the life cycle, I think it's the same. Ingestion of the infected larvae or infected eggs, then to the intestine, then the adult will lay the eggs, then the eggs will be carried by the feces, then to the environment, then back to ingestion again. Okay, they are somewhat the same. So, moving on, there are also some of the nematodes that can penetrate through your skin. So, if you remember before, when you were a toddler again or a child, your mom always told you to cut your nails very short, cut your nails. So, and they will get angry if your nails had yuta or soil under your nails. So your mom will get angry if they will see that, especially when you are outside playing, and when you come home, they will see the soil under your nails. Your mom will get angry. If it's not your mom, your yaya will get angry. Okay, so that's the reason why na they always cut short your nails during childhood because of this. So siguro before, but sometimes they will get confused if ascaris and hookworm are the same, but they are not the same, huh? So always remember, they are not the same. So if in terms of adult, they are really not the same. But pero as a layman's term, they will think na, of course, generalized, they will think na parasite or bitok, same ra, especially in the Philippines. Okay, so for your hookworms, you have two hookworms, your Ancylostoma duodenale, your old world hookworm, and your Necator americanus, your new world hookworm. So the worm still almost the same. The worm develops in the intestine. The eggs are released with the feces into the environment. Then the larva hatch and develop in the environment. Then that larva will penetrate or you get it, I don't know, by touching or anything ba na touch sa soil or in the dirty places na we do not know because we cannot see. And then the infection occurs when the skin is penetrated with that parasite and you happen to eat, especially with your hands, without washing, without cleaning. So you ingested the larva through that. Okay, so hookworms or hookworm infection is the disease, then the infective stage compared to the other two is your filariform larva. So the mode of transmission is ingestion again and penetration under the skin, or it can be in your hands or in the foot. So this is the reason why na you are not allowed to go out not wearing your slippers or your shoes. Okay. So the site of infection is on the small intestine, but it can also migrate to your heart and lung. So for the diagnostic stage is your eggs, meaning you can only see the eggs. You can see the eggs. Same with your ascaris and your enterobius under the microscope by direct fecal smear. Okay. So for the clinical findings, because if you see the hookworms, their mouth have tooth. That's why they are called the hookworm. So this tooth that's the one that will penetrate or will penetrate to your villi so that they can grow there, and they, unlike to your ascaris na they have no tooth, so they cannot stay long. So that's the penetrating characteristic of your hookworm, na they can stay longer and can suck more nutrients in your body. So the clinical findings, if the child or the person have hookworm infection, some or mostly they will have iron deficiency anemia due to blood loss because of that attachment in your intestinal villi. So some will have cardiac problem if the hookworms will migrate to the heart. Then some will have skin manifestation like allergy like symptoms, and we call that the ground itch. So there's scratching, the child always scratching na there's no reason for the scratch or the itchiness. So pwede siya na reason because of that skin penetration. So you will also have respiratory symptoms if the larva will migrate to the lungs. Okay, so you can diagnose hookworm by simply ordering a direct fecal smear and you can see the egg in the stool. So for the treatment, it's basically the same with the others. So you give, that's why na I said na as generalized in layman's term, they call it as parasitic infection or BTOC. So they don't know if it's ascaris or hookworm, but for them it's the same parasite. Okay, so we also give the same treatment, the albendazole, mebendazole, and the pyrantel palmate. And it is proven really effective. There's no new drug that we can give because these drugs are already effective for parasitic infection. Okay, next, let's go to your strongyloides. Oh, no. Strongyloides is part of your nematodes, but I will give you this as your reading um reading assignment. But still the same with the others. Thing same life cycle and same everything on and all. Also, I just want to emphasize na we also have the triad of infection when you say of nematode infection. So when you say of triad of infection, meaning the three parasite are present in one human being, in one infected human. So the presence of your the presence of your Enterobius, the presence of Ascaris, and the presence of your hookworm. So they can be present. And sometimes they are part also your other parasites are present. So if that three are present or two and some other parasites are present, we can all tell that there's triad of infection. So there's also one parasite that is present, needed, your Trichuris trichura. So I have a patient before that three parasite are present. So very sad to know na it's really on the hygiene part ang problem. Mm. And when they go to the clinic, they get ashamed. So when you lecture about hygiene and everything else, they will just nod their head. But in fact, they are not doing it. Okay. So that's the reason why always, aside from hygiene, we need to really wash the hands and clean our foot with every day, especially when it's exposed to the soil. So because we might never know or we will never know kung there's parasite or not, especially in the toddlers yun ni. So in the adults, not usually, but because the adults sometimes will not not get, excuse me, will not get the symptoms. So again, my lectures are shortcuts, so it's your job to read the whole nematodes or the whole intestinal nematodes topic in your book. So next is your tissue nematodes. So tissue nematodes divide into lymphatic, skin and subcutaneous, and conjunctiva. So under your lymphatics is your Wuchereria, Brugia, and your Brugia malayi and your Brugia timori. So for the subcutaneous, you have your Loa Loa, also known as your African eyeworm, your Onchocerca, also as your blinding malaria filaria, and your Dracunculus medinensis or your threadworm. So this is a simple table, but a very good table for you. So you can study and by can focus on studying. So by this simple table, this is very okay already na you have this as your study material. So For example, for your Wuchereria, the disease is called your elephantiasis. Then tropical and subtropical distribution, geographic distribution. Then the location in adult are your lymphatic vessels, of course, because they belong to the lymphatic filarial worms. So for the location of microfilaria, blood, they are nocturnal in periodicity. Then there's a vector involved. So remember when you say when you study of tissue nematodes, do not forget that they need a vector. Okay, so the vector for your Wuchereria are your mosquitoes. And for the lab diagnosis, you have a blood film. Not the stool, you need a blood film or slide to diagnose. So next is your Brugia. Same with your Wuchereria. So the disease is still the same, elephantiasis. Then the geographic distribution around Asia, then still in the lymphatic vessels. Then you need your blood, still with mosquitoes as the vector, and you still the same with the lab diagnosis, you need the blood film. So you have your onchocerca that causes your river blindness. So the disease is called onchocerciasis. So usually found in Africa, Central and South America, including your Yemen. Then it is found in the subcutaneous nodules or subcutaneous area. So the location is usually in the skin, the eyes, and there's no periodicity. Your vector is your black fly. So the diagnosis, you need a skin snip. So for the loa, you have your loiasis. So for the geographic distribution, it's found usually in Central America or Central Africa instead. So for the location, it's a moving subcutaneous tissue. So it can move. And then the location for the microfilaria is still, it's the same blood, but they have diurnal periodicity. So they have the vector, the deer fly. Okay, remember onchocerca, black fly. For your loa, you have your deer fly or your chrysops. So for the lab diagnosis, you have your blood film. So for the non-filarial tissue nematode, you have your Dracunculus, your Trichinella, and your Toxocara. Okay. So for the disease for Dracunculus, you have your Dracunculiasis or the guinea worm disease. Then the mode of transmission is ingestion of infected cyclops in water. Then the location, subcutaneous, mainly in the lower limb. So the diagnosis is clinical and the treatment is surgical extraction. So meaning by clinical, it's okay if you do not request for any laboratories. Okay, just by the signs and symptoms and the history and PE. So next, we go to trichinella. So trichinosis or your trichinosis. So ingestion of larva and in undercooked meat. So the locations are usually in your muscles, lungs, and brain, some in the heart. So for the diagnosis, you have your serology test, muscle biopsy. Then the treatment, you give albendazole. For the Toxocara canis, they are visceral larva migrants, so ingestion of infective eggs in soil. So abdominal organs and brain, then Diagnosis, serology by ELISA, and then simple, the treatment, albendazole. So why, let's focus on trichinella. So why trichinella? Because it is more common and widely na encountered tissue nematode compared to the other two. So the infective stage is your encysted larvae. So undercooked meat. So pig is your main reservoir. And the site of infection is the striated muscles and small intestine. So for the diagnostic stage, the larva in muscle and tissues. Then for the clinical findings, larva migration in muscular tissues causes facial and periorbital edema, rashes, muscle pain, and conjunctivitis. Then for the laboratory diagnosis, by muscle biopsy gyud ang important to identify the larva in the striated muscle. Then there's eosinophilia in the CBC, and you can always do the serologic test. Then for the treatment, mebendazole or albendazole. Then let's go to Wuchereria. So why Wuchereria? Because it is common, it is the most widely encountered tissue nematode. So worldwide, usually in the tropical areas. So elephantiasis, the disease, or your Bancroftian filariasis, your lymphatic filariasis, or your wuchereria. So the vector is your mosquito, specifically your Anopheles mosquito, or sometimes your Culex mosquito. So the infective stage is your larvae, and your diagnostic stage is your microfilaria. Okay. Remember infective stage is different from your diagnostic stage. So when you say of diagnostic stage, the one that is found in your diagnostics or laboratories. Infective stage is the one that's causing you the infection. Okay? So habitat, so the lymph nodes, the lymphatic glands and vessels in the legs and arms and genitalia. So for the symptoms, so inflammation of the vessels, rupture of limbs, fibrosis leading to obstruction, then thickening, hypertrophy. Wait lang. Then some enlargement of tissues, especially in the lower extremities and genitalia. So, mo ni siya. Diba? If you seen those na, but rare, dili man kayo common in the Philippines, but there are patients na with filariasis in the Philippines. That's why the DOH has a filariasis na program. That's why pod na, or the reason why pod na it's not na usually encountered now because of the DOH program, the filariasis program. Okay. It's common in Mindanao and some parts of the Visayas, ang filaria. And there's a medication. So if you have patients with filaria or filariasis, advise them to go to the health center or your local barangay health center because they have that key, and they know, they have instructions before giving the medications, and they need to do confirmatory test for you to be able to be started with the medication. So the treatment is your carbamazine and surgical removal of the lymph nodes. So to those patients na you will see na enlarged na gid kaayo ang feet, ang leg and all, I think that enlargement is irreversible already, or maybe before that they did not seek consultation. So you have your loa-loa. So common name is your eyeworm, common in Africa. So the vector is your fly, your chrysops, your deer fly, or your mango fly. So subcutaneous tissues and muscles. Then the disease, this is the loiasis or your Calabar swelling. Okay. So symptoms, angioedema, swelling of various parts of the body. So conjunctivitis, irritation, edema of the eyelids, and impaired vision. So diagnosis is your demonstration of microfilaria in the blood. And the treatment is the same, diethylcarbamazine. And for microfilaria and adult, then sometimes they give the soothing lotion for the Calabar swelling. So this is a very good slide. So you can study this also. Very easy to study if it's in table form. So there, it's summarized already. Okay, so that's all for